please introduce yourself?
I am Chelsea. I am a CNA/medical assistant/receptionist.
Based on your professional experiences, how important is one's mental health, especially in the older population?
It's very important. I've battled depression and anxiety myself, so at that age, battling that, the wear and tear on your body, it really does. Exhaustion and, down to pure making your body hurt, having you just not even feeling like yourself or thinking properly. Like, it's very important.
Depression is an illness that a lot of us are too familiar with, but often overlook in the elderly population, despite the fact that suicide and depression rates increase steadily after the age of 60. What's even more concerning is a study conducted on over 75,000 nursing home patients that revealed 48% of residents had an active depression diagnosis. Of the 48%, nearly a quarter did not receive any treatment at all, and only 2% received psychotherapy. The most popular method of treatment was antidepressant drugs alone.
This poses the question of why. Why are the depression rates in institutionalized elders so much higher than those dwelling in their own homes? Is there not enough attention on this age group? Do cognitive and physical limitations place a strain on mental well-being? Are the residents able to work through their rapidly changing lives in this environment?
When creating a healthy environment in a long-term care facility, it's important to consider psychosocial factors and their impacts. Things like fear and anxiety, community isolation, and the strain that hopelessness puts on one's will to live are all very impactful for mental health. It's also crucial to understand the positive impact that meaningful activities can have, and to be aware of certain signs and symptoms that may indicate something's going on.
Anxiety is something that 1 in 3 people deal with at some point in their lives. Within nursing homes, 15% of residents are dealing with some form of this condition, whether clinically diagnosed or not. The Center for Disease Control and Prevention describes anxiety as worry or physical symptoms causing clinically significant distress or impairment in social, occupational, or other important areas of functioning. Symptoms of anxiety can easily lead to other mental health problems such as depression, social isolation, and withdrawal from meaningful occupations. The effects of this can be detrimental. These may include a decline in the ability to carry out daily tasks, poorer health, decreased life satisfaction, and depression over time. The management of feelings of anxiety and effects like these is vital for assisted living and nursing home residents and the integrity of their quality of life.
Social isolation, or the lack of meaningful relationships and social interactions, puts the elderly at a significantly higher risk for developing depression and feelings of loneliness.
The percentage of senior citizens living within care home facilities that display signs of loneliness is over double those that reside in community dwelling populations. Withdrawal from self-care routines such as showering and exercise, as well as the refusal to eat and take medication, are common issues arising due to the effects of current isolation policies within nursing homes. Social isolation has also been shown to have a 50% increase in the risk of developing dementia, a 32% increased risk of having a stroke, and a 29% increased risk of incidental coronary heart disease.
Evidence shows that isolation has detrimental effects not only on the elderly's mental health and well-being, but their livelihood.
To overcome these circumstances, it is important for staff to help clients feel engaged so they may regain their joy or purpose in life. Relocation or changes in physical health or status can impact residents' mood, confidence, and sense of value. Staff can suggest and prepare activities for the residents to participate in hopes that their engagement will provide mental and/or physical stimulation. Depending on what interests each resident, staff can create groups to play games, read books, or go on walks together, creating a sense of community within the home. Some of these folks may be still adjusting to life in their new home, and it would be important for them to build connections with each other early on. We may not know what someone is going through, but we can still be there for them so that they don't have to go through anything alone. Loneliness can reoccur often, but having a constant support system with daily relationship can be very instrumental in lifting morale. Creating these bonds can help individuals feel less isolated and more reliant on one another for companionship. Following up with everyone's mental health could include mental check-ins on a regular basis to maintain the ongoing development of a positive environment.
Meaningful activities have a huge impact on the older population. These activities include anything that holds meaning to a person or part of their daily routine. As people get older, their occupational performance becomes less predictable as positive visions of future occupational performance tend to be reduced. Oftentimes, when the patient is relocated to skilled nursing facilities, their occupational performance declines. Some of this comes from the environmental changes that they had to suddenly take on. Interruption in one's daily routine is very likely to cause psychosocial factors to rise.
For this reason, it is very important for us as healthcare professionals to have a client-centered approach with each individual.
Putting our clients first allows us to assist them in achieving their maximum functional independence. We find out things that they used to enjoy doing before whatever landed them in the nursing facility, then work on helping them regain that function, even if they require a little assistance with it. Enabling them to do these things improves their mental and physical function, and overall increasing their will to live.
What would you suggest to someone who thinks the client is suffering from depression?
Talk to them. Talk to their nurse. Notify the nurse or doctor that you're seeing signs of this or that, but that person, if you can relate, try to relate and let them feel comfortable to know you understand. Maybe they'll open up more. A lot of times with depression, you want to sink into your shell even more, and that's really the worst thing. You need to be out more, socialize more, but definitely talk to their nurse and doctors. Make sure it's charted so somebody can try to help the best we can to get them back up to par.